There's some good news for folks in New York State. Governor Cuomo says he'll phase out the lockdowns there and start opening up. The northern part of the state comes first, then maybe New York City by late spring. Cuomo's COVID-19 orders are among the most restrictive in the nation. But have they been necessary? Our next guest says the science has not justified the extreme political response that we've seen in various states around the country. Michael Betrus is a coronavirus researcher, author of the book COVID-19 Lockdowns on Trial. Michael, good to talk to you again. So first, Governor Cuomo is now having a change of heart. So why? Has the science changed?
No, I think the economic devastation has probably changed. But, that's a good sign. That's a game changer for Governor Cuomo. I mean, if you have Illinois or California or New York start to open up and send that message, that will probably be a bit of a domino effect on other states that have restrictions. So I consider that a game changer. Maybe, too little, too late, but never too late, right? It's got to happen.
Better late than never, I guess. Our CBN News contributing reporter Chuck Holden was recently in Armenia. He said few people there are wearing a mask. Armenians have few restrictions. Their COVID death rate has dropped. We've seen the same thing happen in some other countries, also in various states right here in the U.S. So why is that, Michael? Don't we need social distancing and masks to stop the spread of this deadly virus?
I think it's an interesting question. I saw this great Twitter video a couple days ago, and somebody was vaping with an e-cigarette, and they tried on several different masks. Now, the exhale from a vape is actually larger particles than what you would have with a viral particle with SARS-CoV-2. And you could see the seepage coming through everywhere, the sides, the top, and through the mask itself. That's why you don't see any suppression from mask-wearing areas, whether it's cities, states, or countries. When the virus comes in, it does its thing, and then it leaves, 3 to 6 weeks later after its wave. And that's why you see, when you look at South Dakota, North Dakota, Florida, those areas with light restrictions, they should be getting blown away in both COVID and excess deaths by restricted states. They're not. They're all statistically about the same, which really just shows you that the lockdown mitigation efforts, they just don't really do anything with incredible harm to kids that are out of school and people that aren't working, things like that.
Well, you've questioned the case and death numbers that the CDC is releasing. Explain why you question those numbers.
Well, they question the numbers too. So going back several months, they've said that the numbers are overstated. That's not minimizing that COVID-19 is real. It's real. It's caused maybe 250,000 excess deaths in 2020. The lockdowns have probably caused another 100,000 deaths or so. And so what you see is when you look at the big hospitalization numbers, like 130,000 right now, about 2/3 of those are actually caused by COVID, people that are in there with COVID-19. The rest of them, because we have 100 to 150 million people that have been infected, you're going to have a lot of people in the hospital that are positive with the virus, but that's not what they're in there for. They're asymptomatic. They're not sick from the virus, but because they have it, that counts as a death or a hospitalization.
And now it looks like anyone traveling from another country to the U.S. will need to be tested for COVID before being allowed into this country. So what do you think of that requirement?
I'm not sure how much it actually is going to have an impact when you've got such widespread community spread within the United States. But, for me, my charter, my purpose is we need to get our schools open. Like, it is a human rights crime that our kids are not in class. There's no data anywhere in the world that supports the kids should not be in class. Not one outbreak or hospitalization death associated with kids being out. So let's get our kids back in school. Let's get the restrictions lifted so people can get back to work. And then we can kind of worry about some of this other stuff.
Well, from everything that you've been saying, I'm guessing you believe more is going on here than just protecting the health of Americans?
I'm not a conspiracy theorist. The restrictions are simply not in sync with the risks to the general population. I mean, again, you've got the median age of deaths for COVID-19 hovers around life expectancy. 96% of all the people that die have 3 or more comorbidities. As a general population, if you are healthy and you are under 75, you are at very low risk. If you are under 50 and healthy, you're at practically zero risk. And so, and you can see this correlate. It's while there's Democrat-led states might have tighter restrictions by some correlation, there's a lot of Republican-led states too. So it's really time for governors to open up and protect those that are at risk, get these vaccines out, and let everybody else get back to normal.
So do you think we will get back to a pre-COVID normal? What do you think might happen in the future as more Americans get the vaccine?
I think COVID is something we're going to live with forever, sort of like a cold virus. I think we will be registering COVID-19 deaths or hospitalizations for a very long time. I do think that the vaccines will be a game changer. I encourage everybody to take them. There certainly is some risks, but these governors are not messing around, right? We've had 10 months of lockdowns, and it feels like the best way out of this is for people to get this vaccine and we move on.
Okay, the book is COVID-19 Lockdowns on Trial. Michael Betrus, thanks for setting us straight today. We appreciate it.
Thank you, Gary.